Hi friends, welcome to the question of the day. Please subscribe to the channel below and keep on watching for more interesting questions. The question is, mother of a 4-year-old child is worried for her child and brings him to the hospital with altered consciousness, high fever and neck rigidity. The cerebrospinal fluid or the CSF sample is cultured and gram staining from the growth obtained reveals the following picture. What is the most likely organism? And in the options we have Streptococcus pneumoniae, Streptococcus agalactiae, Streptococcus pyogenes, and Staphylococcus epidermidis. The catching point in the question is the age of the child 3 years with the sign and symptoms like altered consciousness, high fever and neck rigidity. That is very suggestive of meningitis. Also, the sample here is the CSF of the cerebrospinal fluid, which again points towards meningitis. And finally, we see the gram staining image, which shows the gram-positive cocci in pairs. So, our first option, which is the Streptococcus pneumoniae, that is the final answer as the gram stain image clearly shows gram-positive cocci present in pairs. Like you can see here, 2 cocci are present together. So this is gram-positive cocci in pairs, and this is the first option, Streptococcus pneumoniae, and it is the answer. Now let's also see the other options. In the option 2 and option 3, both the organisms are Streptococcus with different species. The second option is the Streptococcus agalactiae, which is gram-positive cocci in chains, and also the next species Streptococcus pyogenes, which is also gram-positive cocci in chains. So these are the images. If you get such image in the question, then your answer would have been Streptococcus agalactiae, with obviously change in the age group of the person. So this is the gram-positive cocci in chain, which you can see, and this is a magnified image on the left side where you can see how these gram-positive cocci appear in chains. And both these species are of Streptococcus. Streptococcus are basically gram-positive cocci in chains, but Streptococcus pneumoniae, please commit to memory, it is gram-positive cocci in pairs. Our last option, that is option 4, is Staphylococcus epidermidis, which are the gram-positive cocci in clusters, because all the Staphylococcus are gram-positive cocci in clusters. So if that would have been the answer, then the image would have been like this. On the right side you can see this gram-positive cocci in clusters, and on the left side you can see the magnified view of the same. So the option 2, 3 and 4 are ruled out. Now coming to the causes of septic meningitis or the bacterial meningitis, and as the age group of 3 years is given in the question, so the Streptococcus pneumoniae is the most common cause of septic meningitis. And other causes include Neisseria meningitis and Haemophilus influenzae. But in case the question had neonates as the age group, or the person suffering from meningitis would have been neonates, then the causes would have been totally different. It would have been either Escherichia coli or group B Streptococcus, that is Streptococcus agalactiae, or other gram-negative bacteria, most commonly Klebsiella pneumonia and Listeria monocytogenes. So keeping in mind the age group of the person, that is 3 years, these causes of septic meningitis in neonates is ruled out or excluded. And we have Streptococcus pneumoniae as the most common cause, and also as shown by the gram stain image. So guys, I hope this question was useful to you. Keep on watching for further videos. Thank you.